Thank you for coming to this interview. You are going to cover different questions related to global health, so we can start now. The first question is, global health seems to be in the news more and more in recent years. Talk about what global health is and why it is important to pay attention to it.
Thank you very much for your time and for allowing us to explain different global health concerns. So with the first question, global health is a new in health for all people by species from the trademark book on this planet. So as the definition explains, global health covers equity in different global health services to make sure that all countries or all beneficiaries are having global health services or global health is delivered equally worldwide. So paying attention to global health is important to different government health organizations to make sure that all countries worldwide, especially the vulnerable ones having different diseases, are receiving healthcare services as they need it. And lastly, paying attention to global health helps to know what are the gaps in health systems in different countries to make sure those gaps are filled. Thank you.
Thank you so much. Moving to the next question, you are going to answer some disease can come to us in different ways. Explain the difference between communicable and non-communicable disease.
Thank you very much for the question. According to Alameda County Public Department, a communicable disease is the one that is spread from one person to another through different ways. Especially when you have a contact with the blood or body fluids of that person infected, there is breathing in an airborne virus or being bitten by an insect which spread that disease. Communicable diseases are spread in different ways, but an emphasis is that it is spread from one person to another. So on the other hand, non-communicable disease is a disease that is not transmitted from one person to another, which is the opposite of the communicable diseases. So a good example of non-communicable diseases are chronic diseases, for example, heart diseases, cancer, diabetes, all those are non-communicable disease because one person cannot contact with the other and get that disease. Thank you.
Thank you so much. The third question says, let's talk about Ebola. Since I'm sure most of our viewers have heard a lot about that. What is it? Is it a communicable or non-communicable? How do people get it?
Thank you very much. Ebola is the serious disease in the news these days, and different people know about it. But to explain more, Ebola is got from different Ebola virus species, and it is an infection which is an animal-borne, which means that it is spread by animals to humans. So there are different Ebola virus which spread the disease into humans, and one way or different ways someone can get Ebola is when the person gets in contact with the blood or body fluids of a person who is infected. When the person gets in contact with the object that have been contaminated by the other person's body fluids, when the person gets into contact with infected fruits, bats, or primates, which are the animals. And fourthly, someone can get Ebola when a man's semen who has recovered from Ebola. So this is when someone sleeps with a man who has recovered from Ebola. That time also the person can get Ebola. Those are the main 4 ways that someone can get Ebola from.
Yeah. Thank you so much. So the next question asks, what would raise a person's risk to get Ebola?
As I've been saying it, you get Ebola when you get into contact with the person's body or body fluid or blood. So a person risks of getting Ebola is when he or she's going into places where there are different cases of Ebola. A person is at risk when he go to hunt wild animals for food. There you can meet Ebola viruses, and healthcare providers and families of Ebola patients also are at risk of getting Ebola. And fourth, when a person is having sex with someone who has recovered from Ebola, that time he's really at risk of getting Ebola.
Thank you. After understanding the risk of getting Ebola, so to prevent or at least lessen the chance of getting Ebola, what should people do?
Okay, thank you very much. I think these are the tips people should pay attention to it because to help us to prevent Ebola. So if you are traveling to areas where there has been Ebola cases, someone should make sure he or she does the following. You need to practice carefully hygiene, avoid going to places where Ebola has been diagnosed, avoid going into contact with the man semen who has recovered from Ebola, avoid handling materials of people who have had Ebola, avoid going in places where Ebola have been treated from, avoid going to funerals of people who died from Ebola. Like different people feel like we are very close to those people and we need to go to the funeral or to the burial of those people, but people should prevent that. So another thing is that they should avoid contacting bats or non-human primates as well as avoiding contact with the body, fluids, blood, or meat of those primates. Lastly, people should, after coming from places which had Ebola cases, take 21 days and seek medical care if you have symptoms of Ebola. So if you have gone to the place, like to the burial, or you have gone to visit someone in places where they had Ebola cases, take 21 days. If you have the symptoms, the person should go to seek medical care.
Thank you. Moving forward, outbreaks such as the one related to Ebola can generate a lot of rumors and misinformation and even panic about what the disease is. How is it transmitted and how likely people are to get it? Talk about the need of educating people what facts versus myths.
Thank you very much. So educating people about facts versus myths will help in stopping Ebola and other infectious or contaminated diseases, which we took Ebola as an example. So when people have myths or wrong information regarding something, they don't work hard to fight it, especially a bad one. They cannot stand up and fight that thing. So the time people rely on the myths about Ebola or other diseases or other crucial thing, they cannot take measures to fight against it. So knowing facts and knowing the real information about Ebola cases will help people to know where they can get Ebola from, how is it transmitted, and take the right measures to prevent it. Thank you.
Thank you too. We are moving to the next question. It's asked, how about the complication that Ebola raises for the rights of travelers and responsibilities of government? Cassie Hicks, for example, a nurse from Maine who returned to the States following a trip to West Africa in the fall of 2014, promptly had quarantine-related restrictions thrust upon her, restriction that she was very much against. Briefly describe the difficulty of balancing individual rights and governmental responsibility.
Thank you very much. This is a crucial question because different travelers or different people think that the government or the authorities are denying their rights because they are preventing them to go to places where there is Ebola, especially in 2014 in Africa, in North Africa, there have been many Ebola cases and different travelers were prevented to come there and they thought it is denying their rights. So in an epidemic disease case like Ebola, travelers meet complications like that. So as an individual, you think that there's a time to departure, so you need to go where you wanted to go. So people think they are not respected when they are denied to have their rights. So in the time they arrive of going, they are like, we need to go because it was our plan. So the government takes different measures to prevent those people and can have misunderstanding because individual expectation are not meeting the government expectation. Therefore, balancing the individual rights and the government responsibility is very hard in this situation, but both of them decide to do what is beneficial to the community at large. So they need to talk, they have to have a conversation to take the most effective decision in a certain situation.
Thank you. We put an end on Ebola, so let's talk about smoking and tobacco use, which is considered as a big world health problem and raises similar issue to Ebola in terms of right and responsibility. Just about everyone knows what smoking harms health. What does it to the body?
Okay, smoking is a very crucial question because it causes different non-communicable diseases, different respiratory diseases, and reduces health of the smokers. Smoking harms almost every organ of the body, and smoking causes different types of cancer. Among them, there is lung cancer. It causes heart diseases, and for pregnant women, it causes birth complications. So you understand that smoking is a very crucial problem to the whole world.
Thank you. What about secondhand smoke? Explain what is it and how it affects people.
Okay, thank you. Secondhand smoking is also called involuntary smoking or passive smoking. Secondhand smoke comes from the smoke exhaled by smokers and from a cigarette, pipe or tobacco burning. Passive smokers get nicotine from the tobacco or a cigarette, and those harmful chemicals from the smoke and the passive smoker gets the harmful chemicals as the primary smokers. So secondhand smoke causes diseases and lead to death, even more at a high rate than the primary smoke. So among the diseases it can cause, there is lung cancer, also heart attacks and stroke. The substances in the smoke affect the blood vessels and hence have heart attacks and stroke. So therefore, secondhand smoke is as well very dangerous as primary smoking, and smokers inhale as the primary smokers inhale because they contain the same nicotine as the primary smokers are getting from the cigarette. So secondhand smoke is also dangerous as the primary smoke because the passive smoker gets the same substances like the primary smoker.
Thank you. The last question is, people don't typically think of tobacco as a drug like heroin or cocaine, but the addiction it creates is strong, isn't it? Should we think of tobacco use as a form of substance abuse?
Thank you very much for this question, and it is an important question to tackle because different people take tobacco and different government and authorities take measures to other drugs like heroin and cocaine but don't think about tobacco. Tobacco creates a strong addiction to the tobacco users because of the substance it contains, which is called nicotine, and tobacco users are not normally addicted to the cigarette itself but to nicotine. So you understand that tobacco users can also be addictors like the cocaine takers. So nicotine activates pathways in the brain which controls feelings of pleasure. This is very common in other drugs abuse. So you understand that also tobacco is a drug because it contains nicotine which affects the brain of the tobacco taker. Because of that, I think we can take tobacco use also as a form of substance abuse, and this is because the way nicotine substance, which is in the cigarette, affect the brain as the body in a whole. Nicotine makes people addicted to take tobacco to search for the pleasure that nicotine gives them. Hence, they end up using tobacco very much. So you understand that tobacco users take tobacco not really because they want tobacco, but because they want the substance in tobacco, which is called nicotine, which makes them more of addictors like other drugs. So this is also a drug abuse, and we should also fight it like other drugs. Yeah.
Thank you for sharing with us this information related to global health.
Thank you too.